What is best procedure for baggy eyes, negative eye vectors, and dimple indents? I'm a 40-year-old female with negative eye vectors, horrible bags, deep creased dimples on my cheekbones, and a hooked nose. I want to get rhinoplasty, but first I want to correct the bags under my eyes that always make me look tired even when I'm not. I look horrible in pictures, regardless of the lighting. I want to know if tear troughs are my best option for a long-term solution. If not, what is?
Thank you for your question. You're 40 years old, and certainly it's clear by your question that you have a lot of concerns. You have been doing some research. You use terms like negative eye vectors. But from this question, clearly you're most concerned about the under eye bags, and you're seeking guidance as to what to do. Well, let's start by dealing with what is the cause of these bags. And at 40 years old, you're also experiencing some of the natural changes that are impacted from genetics as well as facial aging. I'm a cosmetic oculofacial plastic surgeon. I specialize in facial rejuvenation and complex eyelid surgery, and I practice in Manhattan and Long Island for 20 years. I can certainly give you a perspective as to what would be my approach for someone like yourself. In the absence of a physical examination, what you appear to have is something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward and acts like a hernia, creating these bags. So regardless of how much sleep you get and whatever it is you do, you're still going to have the bags under the eyes, and so they need to be addressed. When we do an examination of your lower eyelids, we look at several factors. One is the presence and the degree of fat prolapse, as I just mentioned. The other factors include skin quality, skin quantity, as well as integrity of the support of the lower eyelid. You mentioned a negative vector. Well, that's a very important factor in determining the optimal solution for lower eyelid surgery. People with negative vectors are at higher risk for complications such as eyelid retraction, ectropion, or rounding or scleral show of the lower eyelids. And it has to do with the physics of the procedure as well as the way the body heals after this procedure. With that being said, without getting unnecessarily technical, typically in my practice for someone like yourself, I would perform a transconjunctival lower eyelid blepharoplasty to address the fat pockets. This is a procedure where we address the fat pockets from the inside of the eyelids, combination of resection or removal and repositioning as is appropriate to optimize the shape and contour so that it looks like you never had the bags under your eyes. We also routinely address skin quality with combination of laser or radiofrequency depending on the skin type. Thermal energy does have a value when skin needs collagen, and up to a point thermal energy can improve that. If there is more skin, such as redundant skin, then we have to address that, such as doing a skin pinch, something of that nature, which is done at the eyelid margin. The other thing that we do is we use platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it contains growth factors that helps improve skin quality, improves dark circle discolorations, improves the backbone and the structure of the eyelid in a way that no laser I've been able to ever get that type of result. So basically we work from both the front of the eyelid and behind the eyelid to improve skin quality. We've had very good experience, and particularly with people who are, let's say, darker, more like olive skin and darker. It does really do a nice job, and people who have had sun exposure and sun damage. So for lighter skin people, it's also been of tremendous benefit. I think that the combination, the whole is greater than the sum of the parts. addressing the fat pockets, improving skin quality will make a real difference for the appearance of the under eye bags. At this point, I think you are certainly more than ready to meet with qualified and experienced cosmetic surgeons. I naturally have a bias towards specialists in eyelid surgery because of the unique perspective that we have and the focused area in this very delicate and deceptively complex area. Eyelid surgery is one of in the top 5 most popular cosmetic procedures, but I would estimate, as a specialist who gets to repair a lot of undesirable results for people who come from all over the world, that I would say up to 20% of patients who have undergo eyelid surgery, like people who undergo rhinoplasty, will have some type of issue that needs some kind of unique management or advanced care after surgery. So meeting with doctors, finding doctors who can show you before and afters where you feel like you're comfortable with their results and their style, because this is still about not just technical expertise, but style and the type of results you're looking for. And the type of anesthesia and the experience is also very important for you to be comfortable. For example, in our practice, we do our procedures under local anesthesia with light IV sedation in our own facility. Our patients get to know our medical staff and get very comfortable from the day they come to the practice, because the same people know them and are with them at the time of their cosmetic procedure in our office, so they don't feel like they're getting treated like they do in an institution where they're just another number. And all of those things actually make a big difference. So technical expertise, artistry of the doctor, the support staff that helps the doctor, the type of anesthesia, and the aftercare, all combined maximize the results from my experience, and I've been practicing for over 20 years. So I hope that was helpful. I wish you the best of luck, and thank you for your question.